Good afternoon. I'm Dana Harris, Vice President of Federal and State Advocacy at the Austin Chamber of Commerce. Thank you all for joining us today for our Pulse on Policy series. We know this is a difficult and uncertain time for all of us. The Chamber is trying to do everything we can to provide information and resources to our member businesses. Today, State Representative Donna Howard will be talking to us about flattening the curve and successfully reopening the Central Texas economy. This webinar is part of our Chamber's Pulse on Policy series, and we'd like to thank our sponsors, AT&T and Amazon. If you have a question, please use the Q&A button on your screen. We will do our best to get to as many questions as possible today. This webinar will be recorded, and we plan to share it on our website soon in case you miss anything. At this time, it is my honor to introduce State Representative Donna Howard. Representative, throughout your time in the state legislature, you have been a trusted voice when it comes to healthcare, education, the budget, and other issues facing Central Texans. As always, we are so grateful for your leadership in the Texas House on behalf of the Central Texas business community, but especially during this unprecedented and disruptive time. Thank you for carving out time out of your day to speak with the Central Texas business community about finding the correct balance between keeping Texans safe and healthy while successfully reopening the Central Texas economy. We look forward to hearing about the policies the state has in place, as well as the policies we may need going forward. With that, I'll turn things over to you. Thank you so much.
Thank you, Dana. I really appreciate y'all inviting me to be with you today. I will just say right off the bat that these are challenging times for all of us. I have the spectrum outside in the street right now working on the wires around here or whatever's going on, and I have lost my internet connection. So luckily I have a phone and I'm using that. I see phone calls and messages keep coming through, but I assume that's not going to interrupt with what we're doing here. In addition, I just want to prepare y'all for the fact that I have, my husband had a brain injury about a year ago, and he's at home now, and I hear him in the background. So this is reality. This is life, right? For all of us. We got things going on, and just wanted to sure I said all that ahead of time. But that being said, I wanted to talk about the issue at hand here, which is what is needed to safely and successfully restart the Central Texas economy from a healthcare perspective, as well as from a business perspective. What public policy do we have in place that's helpful, and what might we need to get going forward? So really what this comes down to is we need to weigh what science says is needed to protect the public health against the economic urgency to start opening businesses. That's the crux of this. So we know that social distancing and hygiene, isolation, etc., those things we've put in place have successfully decreased the projections for deaths due to COVID in Texas. The Institute for Health Metrics and Evaluation, which you may have seen referenced even by the White House, originally projected more than 6,000 deaths in Texas by August. They revised that down to 4,000, and the most recent I saw revised that down to 1,000. So that's still a lot of deaths, but clearly a huge difference as a result of the actions that have been taken by Texas and our citizens. Dr. Peter Hotez, who many of you probably have seen on the television, an infectious disease and vaccine specialist at Baylor College of Medicine. He's been all over the media. He says that we can expect declines in deaths if we keep practicing social distancing through May, and then in June, we can move from mitigation to containment. Governor Abbott's task force, of course, is a very good step forward, bringing people together who can help guide us as we move forward, trying to reopen businesses here and reboot our economy. But it really needs to be integrated with those who are doing the modeling, the testing, the contact tracing, to actually come up with a workable and safe roadmap for opening businesses. So the flattening the curve and successful reopening, as we said, is a balancing act getting the economy restarted, but doing so in a safe way. We don't want to lose the gains that we've made. It's very significant what we've been able to do. We don't want to lose that. We don't want to create a second wave. We need to avoid that at all costs. And we need to ensure that the public has confidence in the safety of their going out and frequenting the businesses that we want to reopen. And I know that you know as business people, just as we know as politicians, that having voter or customer trust is extremely important, and you don't often get second chances. The expectation is that when you come to do business with us, you're going to be safe. That needs to happen. And people need to have confidence in that. And we know we all want to get back to work. We all want to get back to whatever normalcy we can get back to, at the same time responding to the growing economic crisis. And obviously, this is affecting a huge number of people in our community, people who, from a wide variety of socioeconomic backgrounds. We've got people who obviously are even challenged with being able to put food on their table. This is extremely, extremely concerning to our community. The governor's trying to get this started, of course, with the executive orders that he's been putting out. He's teased that he's got some more coming out next week. We've been seeing improving numbers in the news and some of the official tallies, but however much we want this to go away, however much we want this to be solved, as leaders, we've got to be asking the right questions and working with the best information at hand to make good policy decisions here. So my primary concerns from the get-go have been the lack of adequate testing and the lack of personal protection equipment, which we all have come to know as PPEs, and the inability for us to really get good answers in a contextualized fashion about what the numbers mean that we are being given. So the Department of State Health Services and the state have been sharing things, and they shared the projected surge that need that we might have if we were not able to mitigate here. And we ended up having to have a large number of hospital beds, ICU beds, ventilators, staffing, those kinds of things available for any potential surge. And this has, of course, been a very good thing that we were planning like that, anticipating, inventorying, and making sure those numbers were available and transparent. If you look at the Department of State Health Services dashboard that they have out there, you will see these actual numbers. You will see numbers that say, how many beds do we have in our inventory? How many beds are available? The same with ICU, the same with ventilators. This is the kind of transparency that is very helpful for us to have. And, you know, we all like to brag about the good things that happen. This is a good thing. The thing is that does indicate that there may be a problem here with being transparent with other numbers, because we have not been able to get good answers when we questioned state leadership about the tests, about the PPEs. This has come from both reporters and from legislators who have tried to nail down some better numbers there. And I will say this is not partisan at all. This is, well, I wouldn't say at all. We're politicians, there's going to be some partisanship. But bottom line is, this is being asked of by Democrats and Republicans. This is the kind of information we all know we need to have. And it's the exact same kind of thing that you would do in managing and planning your own enterprises. The kind of data you would want to have to make decisions about your own businesses. So the state says that as of today, we've conducted 216,783 tests. That's a pretty big number there, but we still remain between 48th and 50th, depending on what day it is, in terms of our testing per capita. Lots of tests have been done, but we're talking about a state that has about 29 million people. And to this point in time, we've done 216,783 tests. And it was only yesterday that we finally started to get some contextualization to this, of how many tests they think we might actually need. It was asked and finally answered to some extent. The governor indicated that he's been informed that we would need 25 to 35,000 tests per day. So this is one of the appointed physicians that's on Abbott's task force, the former Medicaid and Medicare Commissioner Scott Mulholland, he recently penned a report from Duke on what would be necessary to achieve containment. And the bottom line is that he said significantly more testing. That is an absolute bottom line to what we need to have. He and others refer to the number that is suggested by Harvard as 152 tests per 100,000 population. And if we apply that to Texas, that means that Texas should be testing 44,000 per day. So where are we now? Well, yesterday the count was 11,384. Very far from 44,000 a day. And we're still not getting the information about how many tests are being done here in Austin. Dr. Escott, the chief's health authority, said this morning that we can expect an increase in the number of cases because he does expect an increase in our testing capacity here in Austin. But he also thinks that we're going to have an increase as a result of the social gatherings that occurred over Easter, as well as the resumption of the construction work when Governor Abbott decided that that was something that should be included as an essential business. So Dr. Escott is expecting that we're going to have higher numbers here in Austin than we have been seeing. So data and transparency have been a big concern throughout this crisis. And up until just a couple of weeks ago, we didn't even have standard reporting metrics. This is how long it's taken us to get our hands around this. And so there's a lot of concern around the fact that we do not have robust data. We do not have essential data. And this is not just about testing. This is also about the PPEs. Now, PPEs, everybody kind of understands how those are useful in terms of being able to treat patients. You need to have protective gear on so that you don't catch the infection. But we also need this at testing sites, in clinics, in doctor's offices, wherever there's going to be a test taken to determine whether or not you've been exposed or whether or not you're carrying this. You have to wear PPE in order to do the test. So we need a huge, substantial amount of PPE, not to just cover the basics of what goes on in hospitals as well as in clinics, but also to do the testing. We keep being told we have lots of PPE being delivered and distributed in the millions. And every time we have a press conference with the governor and his leadership team, we're told about the millions of gowns and gloves and so forth that have been distributed. And that is all well and good, and it's a very big number. But the fact is that it's not being, again, in context about what we really need. And the fact is that when you talk to those that are actually on the ground, when you talk to the Texas Hospital Association, when you talk to the Texas Medical Association, the folks that are actually on the front lines, they tell us that they do not have sufficient PPE. They don't have enough to cover the things they need to cover. They're still doing things like reusing equipment, reusing gowns, reusing masks, the kinds of things that we shouldn't be expecting them to do, because these are the people on the front lines that are providing the care for us, and we need to be able to protect them. So we still don't know, again, how much PPE we need. It's just a bunch of numbers that keep going out there. And a lot of times the requests that are being made are not being fully fulfilled. So we not only are not having what we need now, but we're not anticipating the kind of stockpile that we're going to need to have in place. So we were told again this week that the Trump White House has promised that we're going to have sufficient testing, and count on that as you may. We still don't have the numbers, and we've been hearing a lot about that, so we're waiting to see what's really going to happen. I know that the National Guard, Texas Military Department, has stepped up, and they are going to be doing some testing in some of our rural areas, which is going to help for sure. And we've had some private businesses that are going to be ramping up some more of their drive-throughs, and so we know we will have increased capacity. We still just don't know at what level. In terms of the vaccine, we know that that's likely not going to be available for at least a year, if not longer. We know we can't wait that long to reopen businesses, but we have to also know is that we have to know that we're going to be able to monitor the reopening in order to keep people safe, prevent the second wave and another round of closures that could be even worse than what we've been going through now. So what I keep asking, and what I think my constituents and Austinites like you would be asking is, what is our plan? How many tests will we need to adequately monitor the situation? How many do we currently have? What is our pipeline? How much PPE do we have? What is our supply chain to ensure that we have continuing capacity? At what point in monitoring would we need to put on the brakes? And how do we prepare for that with as little disruption as possible if that actually happened? Do we have a workforce plan for contact tracing and isolation? In other words, show us the numbers, show us the plans. This is especially critical now as Abbott's executive order has the retail to go beginning this Friday before we have the testing capacity in place. And that's going to be followed up with his April 27th new executive order that he suggested will open business even more. So today on Chad Hasty's Lubbock radio program, Abbott said that he was going to make some announcements about opening, quote, so many different types of businesses. You're going to be able to go to the hair salon and any type of establishment you want to go to. That's great. We all want that to happen. But again, what's the plan to make sure we're safe when we do that? So, you know, thankfully, our community, Austin community, is not one that sits around and waits for things to happen to tell them what to do. I really believe that canceling South by Southwest was extremely important. I know it was extremely difficult. It was very harmful to our local economy. But in fact, it has probably provided us a situation where we have seen less of an outbreak than we would have otherwise. And the whole community coming around that, I think is what makes Austin so special too, as it was a lot of input from a lot of different businesses, as well as the health community, as well as the local political leadership that made this decision. So, and I'm really grateful to the Chamber and others, the homegrown ingenuity that sprung into action here. The Chamber's own executive committee member at large, of course, Clint Hart, with LCRA, is on the governor's supply strike force, and I think that's a great choice there. The Chamber staff jumped into action, identifying regional manufacturing capabilities to help us shore up some of the supplies that we needed. The county, the city, UT, Dell Medical, ACC, they're now talking and coordinating their efforts for short-term, near future, and long-term about what the needs are going to be and how we're going to meet those. And I especially want to give a shout out to the Chamber's Jeremy Martin, that I think some have said he's a Zoom celebrity now for all the screen time that he's been having, trying to make sure that everybody's getting together that needs to have good plans in place for our community. So there's a whole lot more that we could be talking about. I mean, this is obviously going to be affecting our state budget tremendously, on top of the amazingly unpredictable, no one would have ever thought, oil bust that we've just had. So we're going to have huge challenges at the state level in terms of how we're going to prepare for the next, the current budget, what needs to happen here, but certainly in preparing for the next 2-year budget cycle, with the decrease in oil revenue, the rippling effect that has, the decrease in businesses operating and providing sales tax revenue, since that's the largest share of revenue that the state has is from sales taxes. And then, of course, the increased need as a result of COVID that is going to require some services be ramped up. So there's going to be a lot of challenges there. We're still looking at what that's going to mean with the federal government in terms of some of the federal funds that we're expected to get. Certainly looking at what it means in terms of ensuring that our uninsured have the access that they need to testing and to treatment. Done a lot with licensing waivers in order to help with the workforce, so that the governor's had many executive orders about easing up on some of the regulations so that we can get more people into essential workforce needs that we have. uh, food distribution, that's been a huge thing, working with the schools. Done a great job of trying to provide continuing meals for those that need them. The distance learning, the tech community has been stepping up to make sure that they get some of the assistance they need there to be able to take advantage of the online learning that's going on now. Certainly there's going to be impacts with higher education, and that's going to have some impacts with our workforce pipeline. There's just so many things, of course, that are going to keep going on that we're going to need to keep talking about, elections, what we're going to do about those. There's all the back and forth there about whether or not we're going to have mail-in ballots, what's going to happen with childcare, with small business loans, all kinds of things. So I think I'm going to come to a close there. I've been rambling a lot, just trying to get through several of the things that I've been thinking about. I'm happy to try to answer any questions that you might have. If I'm not able to, I'm happy to try to get you some answers. But I know that all of us are working very hard through this, trying to make sure that we take care of our own families, but also take care of this wonderful community and get Austin and our state back to work, get our community, our economy revved up again, but do so in a safe way that protects the public health of our community. So Dana, I will stop there.
Well, thank you so much for all of that information. I think our first question is, it seems there's a great deal of emphasis on testing of a respiratory virus. In this, a person can test negative one day and positive the next. This seems unreliable. Can you elaborate?
Well, I think you hit the nail on the head there, actually. That's the problem with a lot of the testing. We've been told that a lot of the tests have false negatives, which even 1 out of 3, which means that you have people who think that they are not infected when indeed they are, and they go about their business and infect more people. The serology test that we're counting on for the antibodies to indicate immunity. Lots of folks have been talking about that being one of the metrics that we could use to screen who can go back to work to ensure that they are immune. But what you will hear from the experts in the field is that there are no assurances there either. We do not know yet what kind of immunity we will have for this particular disease. And just to give some examples that made it clear to me, if you think about 3 common types of viral diseases and the types of vaccinations that are available or not for them, it could be something like the chicken pox that most of us, when we've had that, don't have to worry about ever having that again. It could be, though, like tetanus, where you have to have booster shots in order to maintain the immunity. Or the worst it could be would be like HIV, where you can take a medication that can protect you on a daily basis, but there's nothing that protects you that you can get a vaccination for that will keep you from getting reinfected or infecting others. So it could fall anywhere in the spectrum, and we don't have enough information to know yet. The herd immunity we can't count on yet. Some have said that we need something in the ballpark of at least 40% immunity to ensure that we can have a pretty robust opening of the economy and knowing that people would be pretty well protected. But this is the issue with the testing. It's not a perfect metric, but it's the metric that we must have, because without looking at the testing, we are flying blind to a certain extent as to how much this has penetrated our community and how much we can count on people being able to get back into the community in such a way that they can have contact with one another without spreading the disease. So good question. Don't have probably a great answer in terms of the specifics, but yes, you can test negative one day, positive the next, and that's the way this works.
Thank you. Our next question, regarding PPE, for example, a typical inner city hospital uses approximately 20 to 30,000 masks per week. Reports indicated this has increased to 300,000 plus. How do manufacturers ramp up this level of service with so many of their suppliers shut down?
Well, that's of course another challenge that we've been having is the supply chain for all of these products. And, you know, some would say that that's the reason that we needed more of a national coordinated effort on this, because what's happened as things have been pushed off to the states and then pushed down to the local communities, they're competing against one another for a lot of these supplies, which is certainly inefficient and more costly for sure. Again, the numbers that you mentioned, I think this is one of the challenges we have too that I was trying to convey, and that is give it to me in context. These are really big numbers we're talking about. Those are big numbers you just gave for how many are required right now in a particular hospital. We were just told in the latest press that we had with we had with Abbott and his leadership team, that they distributed this week alone 4.8 million masks, 453,000 shields, 2 million gloves, and 16,000 gowns. Big numbers, and we're hearing those every single time practically that we have the conference call meetings with them. But then again, when you talk to those that are out there actually providing these services, they do not have what they need. The big challenge that we're hearing about in Austin right now is with our nursing homes, where we have 8 clusters of infection. More than half of those who have died are nursing home residents. We saw, if you saw in the Statesman today, our first person that works in a nursing home facility has died. And we have not had sufficient testing or PPE in the nursing homes to monitor this and take care of it. I know that Dr. Escott is working on that. He is organizing some strike teams to go in now to those nursing homes. He's ordering testing of everybody at one particular site, I've been told. So, you know, again, despite any number that we're given, if we don't put it in the context of okay, this is what we have, this is what we're going to need next week and the week after that and the week after that, we don't have the context that tells us what those big numbers really mean. And that's what we've been asking for in terms of the transparency that we think is important that the state dashboards give to us, so that we actually know that kind of information as well. I think when we're talking about the confidence and the assurance that people need to go back to work and to go back to patronizing businesses, they need to know that they can count on what's going on to really protect us. And just giving the big numbers and shunning the contextualization of those, I think, is a disservice to a certain extent, because it doesn't give us the opportunity to get that confidence.
Thank you. Our next question, Representative Howard, there's so much going on, and, you know, school's out, or they're homeschooling now for the rest of the year. Parents are in AISD. You know, how will this impact AISD going forward, and what do you see? I mean, are there going to be policies that are going to need to be put in place next legislative session to help in this kind of time?
Yeah. I'm very concerned about our public schools after we made such headway last session with HB3 and got significantly more money into our schools, that we want to hopefully maintain that, which is going to be challenging this time. But if you just look at what's going on here locally with Austin ISD, you know, they have to look at what is happening with property taxes and property values, since that's the bulk of the local money that they see coming in to support our schools. I think there's a lot of concern now about that, and some hand-wringing about what their bottom line is going to be. Now, certainly the way that the school finance formula is set up, the state is supposed to cover whatever the local taxes don't cover in order to make them whole. But when you see the state's challenges, there's a lot of concern about where are we going to find that? How are we going to make sure that we shore up our schools and don't fall back behind and lose the gains that we've made? I think it's going to be very interesting to see not only what public education, but also higher education ends up doing with our online learning and the open education resources. We've been working on that in the legislature for the past couple of sessions. First off, trying to ensure that we had broadband connectivity throughout the state. That's been something that we used the e-commerce funds to ensure that that was happening. But then also, how do we get connected to the actual campuses and then to the actual classrooms, and then certainly some that need connectivity in their homes. As we rely more and more on this, that's going to be even more critical. But in terms of those of us that have been supportive of open education resources, I think this is going to give us a little bit of a boost here to show how that can be a useful tool to provide interactive, free access to materials that can be continually upgraded and bring in the current information rather than be as stale as some of the other things that we have been traditionally relying on in our schools to provide. So how do we pay for all of that? How are we going to take care of the extended contracts with our staff at the local school districts? You know, there's so many questions now. I certainly don't know what the answers are. And I know that AISD is talking about this and trying to look at where they're headed, what they need to do. I've been told that they're going through several reviews of their contracts to be able to look at what they might be able to impact there. So, you know, it's very concerning what we're going to be able to do as we move forward, and to have the economic impact really be felt at every level, in every corner of our economy, is going to have a significant blow to how we're going to be able to keep our schools whole.
Thank you. What are you recommending for businesses that will be reopening soon? What kind of policies and changes do you think they'll need to make in whether it's a restaurant or their office or just in their place of business? What do you think? What do you see happening?
Well, at a very minimum, of course, I think following the CDC guidelines and hopefully guidelines that would be coming out of our state health services as well, and out of the governor's task force, which has several physicians as a part of it. You know, the basics that we already know about in terms of ensuring that the staff members have testing and no signs of illness, that there's protective coverings as appropriate in terms of gloves and masks, that there's sufficient distancing to where you're not going to have people closer than what is recommended, that you have a limited number of people gathered in any one space, depending on what the current recommendation is. Again, these are going to be fluid and fluctuating, and we need to be nimble and continue to look at what the monitoring is showing us as to what the peaks might be, and whether or not we're leveling off in infections, and whether or not we can keep going and maybe then start ramping up a little bit more. It's all got to be done in parallel, though, with the testing, because if we get too far ahead of ourselves, then we're going to have to roll things back in. And again, that could take a longer time than if we rolled it out gradually enough to where we were really doing that on parallel tracks at the same time. So, you know, common sense kind of things, but certainly following CDC guidelines. And as I said, I hope the state's going to have some very specific guidelines that businesses can follow to make sure that their staff are safe, and also, of course, that their interactions with their customers, consumers, are also safely done.
District 48 is pretty diverse, stretching from Southeast Austin to 620, and includes Westlake Hills, Rollingwood, Sunset Valley. What are the differences that you're seeing in how COVID-19 is affecting your different constituencies?
Yeah, well, interesting conversation I had with one of the reporters from the Texas Standard last week or so. Looked at that kind of an issue and actually looked at our district and saying how the stay-at-home orders, those that have the so-called luxury, if you will, to be able to work from home and actually follow the stay-at-home orders, that she was saying that when she left for work that day, leaving from West Austin, that it was very quiet early on out in the streets because people were staying at home. The usual busy early morning commute activity was not happening. Then when she got over to East Austin, where she was going for something, it was a buzz with all the folks that were out and about, getting up to go to their 6 o'clock, 7 o'clock a.m. jobs to do food service or to do maintenance work of some kind, to support the grocery store suppliers, whatever it was. That same kind of diversity exists within my district, where there are those that don't have the option to stay at home. They are having to go out and be a part of the essential services. And certainly I'm thinking about my nurse friends that are having to do that, as well as my physician friends and all the other providers in the healthcare setting who have been subjecting themselves on a daily basis to being around this disease, and then having to worry about when they come home what necessary precautions they have to take to make sure that they're not bringing it back into their families. So a real wide variety of impacts and of the way people are dealing with shelter in place. And, you know, I think that we certainly do understand that that this is a disease that has a disproportionate impact on certain segments of our community that have to be on the front lines, and that unfortunately we've also seen it has a disproportionate impact on people of color. And we are trying to get more data about that so that we can understand how we can intervene more appropriately to ensure that everybody is getting access to the care that they need and not somehow slipping through the cracks, whatever the reasons are for that.
Thank you. There are so many people out of a job and they are having a terrible time reaching TWC to fulfill their requirement
Yeah.
prior to qualifying for unemployment or disaster unemployment funds. What are you doing to help these people, and what is the best advice you can give to them?
That is a tough one. That has been so hard. My staff, in particular, Samantha Lopez, who is my administrative director, she's been on the phone pretty much constantly with constituents trying to help them get the information that they need. And she's actually one of the volunteers that the state asked for volunteers from our offices to work more directly with TWC to help them get through some of the applications that they have so they can increase their workforce that way. And Samantha's one of the ones that has volunteered for that as well. So, you know, unfortunately, it's been a cumbersome process. We were not prepared for it in terms of our IT capacity. Nobody could have expected exactly what happened. I mean, I think we all understand that. But the state has been really, unfortunately, unable to catch up with the technology that we need for today. Have a lot of legacy systems that are not interoperable, haven't put enough stuff on the cloud, so that we have had some cumbersome situations there, trying to not have the website just completely collapse. So I know that the governor and others have ensured that we've got more folks over there now, that they've ramped up with a couple of additional call centers, several hundred new employees working on this. I know that one of my family members who had applied from the beginning just got an email today that he finally got an answer to his inquiry. So this is impacting a huge number of people. And, you know, we're hoping that this second tranche of funds that I guess the Senate has voted on, the House will on Thursday at the federal level, will still provide us some more funding so that we can increase what's going on here, because we basically, you know, capped out what we had. So we're looking for more there. But I guess the best thing I can say is it's very unfortunate. I am sorry that we found ourselves in this situation. I know it's been extremely difficult and challenging and stressful for so many families. The state is trying to ramp that up. I hope that this will allow us to recognize why we need to have a more robust IT structure through our state agencies as we move forward, because we have so many people, so many issues to deal with, that we have got to get into the 21st century here on how we're providing IT services. So I'm hoping we're going to be using this as an example with whatever resources we have available to beef all that up.
Thank you. Can you talk a little bit about what the Central Texas delegation, how they're working together to monitor this situation? I know we have Senator Watson serving on the governor's strike force.
Right.
And
yeah, I'm really glad Senator Watson's on that. That's really great to have his presence there. You know, probably like a lot of you, it seems that now that we're at home on our computers doing Zoom meetings and all of this, that we're busier than ever. It feels like I have constant Zoom meetings, conference calls, whatever, and more so than I remember ever having going into the office. So I think we're all keeping busier and busier, and that includes the Travis County delegation. I'm really proud of the people that I work with and the regular communication that we have, trying to respond to the various issues that are raised in our offices and communicating with one another so that we can divvy up the tasks, for one thing, and not everybody be trying to solve every single problem to get individually, but that we can work together and perhaps be more effective that way. I know that Representative Rodriguez has set up a Facebook page that's a Travis County delegations page for having information about COVID response. We've been having a lot of different teletown hall meetings to talk about different issues, trying to make ourselves available to any and every group that wants to have some kind of a Facebook presence or a Zoom presence to talk about the issues. So I can tell you that, and it's not just Austin, of course, Travis County, but also the whole Central Texas area with, you know, Representatives Tallarico, Busey, Sweener, they've been a part of this too. And so there's been a real effort to try to share information and make sure that we're all apprised of the different problem solving, whatever information we might come up with that might be helpful, make sure that we're sharing that with each other and really relying on each other to shore each other up. So I hope that that's something that y'all will recognize and that it will be helpful to you. If you need something from us, I encourage you to contact any of our offices and let us know what the issue is and how we can try to help, because we're really ramped up for that right now, and our staff are working nonstop to try to address the concerns that are coming to our offices.
yes, we so appreciate you and your staff and everything that y'all are doing. One thing I've seen on your Facebook page, as well as a few of our other Central Texas members, is a request to help our food banks and do jobs. Do they need money? Do they need food? What can we do to help?
Oh, that's a great question. Thank you for asking that. I think we're really talking about money in particular here, that's probably going to be the most useful to a lot of our nonprofit agencies right now as they try to provide what is needed. The food drive that you are probably talking about right now is something that we have going on this week with the Mexican American Legislative Caucus and the Texas House Women's Health Caucus have had a food drive this week. And we're really looking at a variety of food banks throughout the state, of course, so we can focus certainly on the Central Texas Food Bank. But yeah, they definitely need contributions of dollars. We've had, if you've seen the pictures, it's astounding of the cars that are lined up when food is being distributed, going on for miles. This is affecting a whole lot of people who have never participated in trying to go to a food bank before. Food insecurity there's 1 in 7 Texans are experiencing food insecurity now. Really, you could also volunteer to help with the distribution. So they need people as well as the dollars. But right now, sending in money is going to be probably one of the most helpful things that people can do. So thank you for bringing that up. And you can definitely go to our Facebook page for the Texas House Women's Health Caucus and get more information about that.
Thank you so much. And we'll retweet that or repost on Facebook to make sure.
Oh, thank you.
About that.
Thank you.
I know that, during this past, month and a half, there have been so many shocks with all of the things going on. But I think one of the biggest shocks came this week with the price of oil not only down, but trading in negatives. So can you talk a little bit about that and how it's going to affect the budget and how it may change the upcoming legislative session?
Yeah, well, we're of course going to wait to hear from Comptroller Hager, who will be coming out this summer with a revised revenue estimate that he's already said will be several $billion less. Luckily, Texas is more diversified than it used to be in terms of our revenue streams. Oil and gas is still a big sector for us, but we're not as dependent on it as we once were. That being said, it's going to be a huge hit. The vast majority of the severance taxes go into our so-called rainy day fund, the Economic Stabilization Fund, which half of the new dollars coming in go directly to our state highway fund, which of course is extremely important to those of us in Central Texas who are interested in a lot of roads, but particularly IH-35. So there will undoubtedly be less funds, less revenue flowing into the state highway fund and the Economic Stabilization Fund. Right now we have around $9 billion in that fund. And we know that when we come back in January for the next legislative session, that there are, before COVID even happened, before the oil and gas bust even happened, we already had some supplemental budgetary needs, because typically the state underfunds Medicaid and comes back the next session and pays the bill that is due. That's going to probably be around $2 billion. Then you add on top of that everything else that might need to be covered, and the lack of revenue coming in. We can anticipate that the Economic Stabilization Fund is going to be used for a lot of things. How far the legislature is willing to go depends on a whole lot of factors that we don't know yet. And certainly with our sales tax revenue, the March numbers were due, I think, this week, and we'll get information from the comptroller on what we saw with sales tax numbers in March, but that's probably going to be about half of that is going to be COVID related. It really won't be till May, when we get the April numbers, that we're going to get more of an idea of what the real impact is there. Certainly the oil and gas thing, not only is it the oil dropping out like that, is the severance taxes to the ESF are a big thing, but it's also the ripple effect of the retail industry, the building supplies, the drilling supplies, all the things that go into that are also going to be impacted, that will affect the sales tax. So big concern. Like I said, it's not as problematic as it may have been at one point in time in our history, but I don't want to minimize it either. It's going to be huge, and we're going to have some significant challenges in trying to figure out how we're going to balance our budget with those decreasing revenue streams, and how far we're going to go with going into the Economic Stabilization Fund, which will have less in it than the comptroller had predicted as a result of this. But even with what's there, is going to have greater need trying to draw down some of those funds.
It's going to be an interesting session for sure.
For sure.
I think we'll take one more question and then ask you to give some final comments. What information would you like to know from the business community right now, and how can we help? What can we provide you to help in your discussions with leadership and your colleagues?
Thank you for that. I really appreciate it. I mean, I think that clearly we need to have input from the business community about what is going to be helpful in getting them back in business, and what kinds of things need to be put in place that the government has any role to play with. You know, we've talked about some of the regulations that could be changed that could impact the workforce. There might be other things as well. Talked about some of the potential small business loans. I know Austin is now going to be having their loan program as well. I think what's important to me as a politician, policymaker, is that we base what we're doing as much on the data as we can. That we need to get the politics out of the way. It needs to be about the science. It needs to be evidence-based. It needs to be data-driven. And I know that there's a lot of people in this community that do the exact same thing for their own businesses. The more that the business people in this community know about what's going on, know about the importance of testing, know about the need to have a strategic plan in place, and can ask those questions of leadership, can support the effort to ensure that we have transparency and that we have an actual plan in place that's based on evidence, that they can be assured that we are not going to make decisions based on some ideology, but that we're going to be basing our decisions on the evidence and holding us accountable to that. So I think there's a huge role that the business community has to play in becoming as knowledgeable as they can be about this, and then demanding that of us, and demanding that we are using that when we're making the decisions we make. I know that this is a partnership, and I respect and appreciate our business community who step up time and time again to help with all kinds of issues and needs in our community, who recognize their role in the workforce pipeline, in helping young children have access to quality public education, making sure that the workforce has access to daycare, which is a huge challenge right now, making sure that there's healthcare access, however that happens, whether it's employer-based or some other way, but you know, we've got to make sure that workers are healthy so that they can come to work. This is all something that our community is already keenly involved with and recognizes. I would just encourage as much of that as possible, and to make your voices heard, to let us know what we can do to get out of the way if that's what we need to do. But I appreciate everything that's going on. I appreciate the coordinated efforts to try to have supply chains in place for some of what we need here. But bottom line for me is going to be making sure that people demand adequate monitoring and testing so that we stay on top of this, we keep people safe, we keep businesses open, we keep moving forward, and we don't end up having a second surge that puts us back further than we ever were in the first place.
Thank you so much, Representative Howard, and I want you to know that the Austin Chamber stands ready to help and jump in whenever and however we can to make this better and reopen the economy and do it in a safe and healthy way.
Well, thank you, and I know you've already done that, so I appreciate it very much.
Oh, well, we're always happy to help you, and we're glad that you're on our team and helping Central Texas. At this time, I want to introduce the new CEO of the Austin Chamber. As all of you know, Mike Rollins announced his retirement last fall, and on Monday of this week, our new CEO, Laura Huffman, started. I know that she's no stranger to most of you. She comes from the Nature Conservancy and was the assistant city manager of Austin back about 12 years ago. And with that, I'm going to let Laura make a few comments right now. So, Laura?
Thanks, Dana. Representative Howard, it's so good to hear your voice.
Thank
You
you.
and I, we've worked together for a long time on a whole
We
bunch
have.
of issues, and I just want to echo what Dana said. You've been a good friend to this entire community, and you are a trusted voice, and for that, I thank you. And in listening to your words of wisdom, I think you're spot on. I think that how this region comes out of COVID-19 will have everything to do with how well we collaborate. And old lines in the sand don't matter right now. And so to the extent that we can keep them out of the way, I think that's great. Many of you may have heard that the mayor and the county judge have asked us, the chamber, to lead a task force that'll be kicking off on Friday. Representative Howard is going to be on that task force. We've also we've asked Senator Watson to make a cameo appearance as a representative of the state task force. And the goal is just to bring the business community in all of its robustness to the table, get everybody's perspectives, and plan a rational and transparent way of reopening businesses in this region, and doing that with the utmost assurance that the community health is at the forefront. So I just wanted to get on and hear what you had to say, Representative, and thank you for everything that you do.
Thank you, Laura, and we're really glad that you're on board. I'm looking forward to working with you.
Thanks.
Well, with that, I think our webinar comes to a close. Representative Howard, thank you so much again for taking time this afternoon. We know that you're so busy right now, and we appreciate your advice and insight into this pandemic. If you on the screen, you should see the upcoming webinars, and we look forward to seeing you all very soon. Stay healthy, stay home, and stay safe. Thank you.